So, with COVID 19 and similar pandemics in the past, it's not just an individual issue, it impacts communities, giant populations. So, that means that's not necessarily a one fit all solution for these types of outbreaks, and they're not going to go away, they're constant. So, what's the best solution to this is to create a surveillance system, to be always on top of the game on what's next. So that's why solutions that may apply to Ontario or other countries may not be perfect for Newfoundland and Labrador, because Newfoundland and Labrador has a very specific demographic and just a socioeconomic platform in general. So what that means is that we don't only have a large aging population, a lot of our population is rural. We have high rates of comorbidities like obesity, cancer, diabetes, and so forth. So we need to understand how COVID 19 has truly impacted our province to give the best shield and best support moving forward. And that's where my thesis comes in. I wanted to have a comprehensive view of COVID 19 in the province and how best to inform future surveillance system for emergency preparedness. So first, I interviewed over 100 COVID-19 patients and their families in Newfoundland and Labrador to understand the lived experiences and how it affected their day-to-day. And what I found was that trust was the most important, because trust allows them to believe in the public health measures that are put in place and comply to them. Next, I looked at the statistics, the numbers. What I looked at every single case in Newfoundland and Labrador up before the mass vaccination was provided to most people. And what it showed is that there's specific risk groups and risk locations in the province, particularly Central Health, for example. Because they have a large rural population, that means access to healthcare is limited. They need our help the most in these types of scenarios. And finally, I did a policy analysis where I looked at the economic burden of COVID 19 within this province and compared it with different surveillance systems and different preparedness plans. And what I found was that having a local provincial surveillance system where we're looking for the virus within our waters gives the best chance moving forward. It's not only cost effective, but it's also accurate, and it gives us, most importantly, a head start. Few days to even weeks at a time before we see hospitalized cases in our healthcare system. So combining the fact that we now have a good surveillance system and building very early trust so that we can enact effective public health measures and prioritizing these risk factors, we give Newfoundland and Labrador the best chance moving forward for future outbreaks. Thank you.